1909th day of continuous webinar. Before beginning the session, we'll have a silent prayer. Thank you and welcome everyone for today's English session. Today's our guest is Dr. Rajeshwari Rapta. She is DHMS, MBA in Hospital and Healthcare Administration, certified weight loss coach, and she have diploma in psychology and counseling, certified BLS and ACLS, and former principal and hospital administrator, and ex-professor of department and head of the Department of Anatomy. And she is the founder and art of Healing Gurukul, and she is awarded the ILPH Adventurous Writer Best Teacher Award and Bharat Shiksha Gaurav Award, and many. She's a YouTuber and speaker, and she's Sarvakala Vallabha. She's and we are happy to get you as a speaker today. Dr. Rajeshwari, you are welcome to IFPH Forum. Please.
Yeah, thank you, Dr. Rajini, for introducing me. And thank you, IFPH, for inviting me to present this webinar. I am grateful to you. Last time we had discussed about ICD-11, and during that time I had also mentioned about NABH, and few of you had doubts regarding what is NABH and how to proceed for it, and many of them even didn't know what it is. So today I'm going to describe about what is NABH and how it is important for homeopathy. As many of you may be related to teaching profession and also related to homeopathic hospitals, you might be knowing that there are few hospitals which are already NABH accredited. That is, in Pune, almost 4 to 5 hospitals are already accredited. The DY Homeopathic Hospital, DY Patil Homeopathic Hospital, DS Sathe Homeopathic Hospital, and Aditya Nikam, Dr. Aditya Nikam's Homeopathic Hospital. All these are NABH accredited. Even in Delhi, Dr. Baxon's Homeopathic Hospital is NABH accredited. Neminath Hospital, Homeopathic Hospital in Agra is accredited, and also in Palghar Hospital, that is also accredited. So, there are these hospitals which are accredited, but what is the importance of it? It is a quality norm which shows that homeopathy follows the quality standards. Okay, so it signifies that the hospital follows internationally recognized standards for patient safety and quality of care. And that is how, trust develops. Trust in the patients develop when they come to know that as it is, internationally recognized and it follows the standards for patient safety. And this accreditation also ensures that the homeopathic treatment is delivered in a proper, structured, ethical, and safe environment. And it also validates that the hospital has a well-documented procedures. It has a qualified practitioners and the mechanisms to protect the patient rights. So this accreditation can enhance the public confidence. It improves the clinical outcomes, and it makes the hospitals more eligible for government empanelment and insurance schemes. Now, about these hospitals which are already accredited, some of them might be, also involved in the CGHS schemes. But you get automatically you get the right to for the government empanelment, and then you can further proceed for these insurance schemes and government empanelment as well. So how to find a NABH accredited hospital? You can just check into the official NABH website, and from there you can get the information of how many homeopathic hospitals are accredited, and how many hospitals have already applied. And you can also, if you're interested as a hospital, you can also proceed further for the accreditation procedure. And if you are a small clinic or a center, healthcare center, you also have that another option for getting accredited. So even clinics and the primary healthcare centers can get accredited. And each of them have their different, norms and policies and licenses which you have to, fulfill during the procedure of application. So, so after getting accredited, first there is an entry level accreditation, and then after that there is a final accreditation. So it's a two-step process. Then first there is a desktop assessment, and after the desktop assessment, then they conduct the on-site. They come to your clinic and or your hospital and then do the inspection, and give the accreditation. So this it's a two-step process. Now let me show you that how it happens. Can you see the screen?
Yes, yes.
So here it is. You can find this document which shows the process of the entry level certification for the AYUSH hospital or AYUSH center. So here you have about what it is. Now this NABH, it comes under the Quality Council of India. And there are various accreditation boards of the Quality Council of India. Okay, and these are some of the abbreviations which are frequently mentioned in their guidebook and all. So here about the organization, the Quality Council of India. It's through the government of India, the QCI. It is an autonomous organization, and that is what maintains the quality standards of the different organizations. Now, under the quality accreditation boards of the QCI, there is the NABH, which we are discussing now, and the NABCB, that is the National Accreditation Board of Certification Bodies, and National Accreditation Board of Testing and Calibration Laboratories. So this is applicable for the different labs. Like you have the Thyrocare, Metropolis. These are all get accredited under this NABL. And National Accreditation Board of Education and Training. Now all these accreditation boards like hospitals or whatever the Quality Council of India undertakes, they require training. So the training is also conducted through the NABT, that is the National Accreditation Board of Training, Education and Training. So you can also get accredited through this board, and you can conduct trainings through this. National Board of Quality Promotion. This is another board. So coming to NABH, it has a global recognition. So it is an institutional member as well as board member of Internal Society of Quality in Healthcare, ISQA it is called as, and it's on the board of the Asian Society of Quality in Healthcare, that is ASQA. So if you get enrolled in this NABH or you get accredited under this NABH, you will be setting a global benchmark. So that is one of the importance. Okay, and you'll be setting the quality standards at the global level. So NABH accreditation, it is aimed at establishing a common framework for the healthcare organizations to demonstrate and practice compliance with the patient safety protocols. And this NABH is operating under various accreditation boards for hospitals, small healthcare organizations, blood banks, blood storage centers, and medical imaging centers, and dental facilities or dental clinics, allopathic clinics, AYUSH hospitals. So we are discussing about the AYUSH hospitals. So certification, NABH is operating various certification programs such as the entry-level hospitals, entry-level SHCO, and entry-level AYUSH hospitals, entry-level AYUSH centers, nursing excellence, medical laboratory programs, standards for emergency department in hospitals. So it has some certified protocols and standards for all these departments. So about the empanelment, if suppose a network of ECHS and CGHS empaneled hospitals, they can also apply for NABH accreditation to provide the quality Medicare to the beneficiaries and their dependents. So as per the empanelment protocols, this accreditation helps the hospitals to ensure the cashless transactions as far as possible for the patient. So it directly benefits the patients. Of course, in an indirect way, it also benefits the hospital because it has set the global standards. Also about the training and education, NABH also conducts various awareness and educational workshops, such as programs of implementation of NABH standards for hospitals. Now, this training I had undergone in 2015, and after that, I started, coordinating the hospitals for NABH work. Now, program on the implementation of NABH standards for blood bank, program for implementation of NABH standards for nursing excellence certification, that is for nursing hospitals and colleges. Then programs on implementation of NABH standards for entry-level hospital. Also, there are the trainings for NABH AYUSH. So if you go to the QCI website, you find all these trainings, and if people are interested, you can apply for the trainings and get trained so that you get knowledge about it, and you can also conduct the coordination work at various levels. Now, why NABH? Why it has to be done? Because it's a national accreditation body, which is aimed to ensure that healthcare organizations are providing quality care and high quality services to the patients. Now, this accreditation status through the NABH, it provides a marketing advantage in the competitive healthcare sector by simultaneously strengthening the hospital's functioning. So it provides a brand to the hospital or the healthcare center as well. It helps gives added advantage for the marketing purpose also. It provides an opportunity for the hospital to benchmark its services with the global standards and then increase the patient footfall and have a share of the growing medical tourism market in India. So NABH accreditation and certification program set the highest benchmarks for the hospital operations at all the levels and across the functions as per the globally accepted norms. Now, the standards provide a quality of framework of the quality care of patients and necessary improvements in the hospitals by systemizing the hospital operations and protocols. Thus, it evaluates all the aspects of the hospital with comprehensive approach before the accreditation. So there is a continuous improvement and enhanced productivity. Now, benefits, the direct beneficiaries are the patients and the biggest beneficiaries again, because they are the stakeholders, and as certification results in the high quality of care and patient safety as discussed earlier. Also, the healthcare organization benefits because of the continuous improvement, and it enables the organization to demonstrate a commitment to quality care. And then it can also derive the opportunity to get the get the best benchmark and also benefit from the financial incentives which are given by various government schemes to such accredited hospitals. Then about the healthcare staff, it also improves the overall professional development of the hospital staff. It provides leadership for quality improvement in various techniques, because training is one of the part or standard operating process in the NABH protocol. So there is continuous improvement, quality improvement is done by this continuous training process also. So it also creates a good working environment where the staff can continuously learn and take ownership of their roles and responsibilities. Then there are the regulatory bodies. The certification provides the access to the reliable and certified information on the facilities, infrastructure, and level of care, which can be used by the insurance organizations and other third parties. Thus, there is a reduction of uncertainties while making the public decision. So, how this accreditation can be done? You have to go to the website, AYUSH website, NABH website. Show you this.
What happened, madam? Now the slide sharing is not visible.
I will show the website, just a second. How to get registered for it. So here is the website, AECL. I can just put it here so that you can log into I'll put it in the chat box so that if you have interest, you can just go there and see how the registration can be done. So here it is. Now this one is already registered one. Application has been sent, and you can see there are the different. You can just register through your center what kind of center it is. So you have to just tick mark whether it is Ayurveda, Yoga, Naturopathy, Unani, Siddha, Homeopathy, or Soarikpa. So you have to just register with your email and mobile number. OTP will be sent to your mobile number, and after the OTP is sent, then you have to just fill in the OTP, and then you are registered. Then you are going to fill the application, and in the application you can see that all these things are there. You have to fill in whether yours is a hospital, how many bedded hospital, or if it is a clinical center, then you have to mention the center. If it is a center, you have to just tick mark the center. And then the general information is also given there. So you have to just go for the general information, write the organization name, the address of that organization, and where it is, the city and the state, and your PAN, GSTN, the organization head name, center coordinator, and all that you have to mention. Okay, what is the location and everything you have to mention. Then the scope of certification comes. In the scope of certification, you have to write about the scope of services provided by the organization. So what services? Scope of services means what kind of scope of services means what kind of services you give. Whether it is clinical service, whether general medicine, psychiatry, obs and gynec, surgical therapeutics including ENT, dental and ophthalmology, and pediatrics and child health. So whatever it is, you have to just mention the services which come under your clinic. Then the list of scope of services provided as per the department. So whether it is a OPD now, because this one is registered under the small healthcare center, so it is comes under the OPD. So here it is OPD. So, and then if it is a hospital, it comes under the hospital, then the different scope of services differ. Okay. And providing the number of patients, while filling the application, you have to fill in the last 2 years number of patients. Okay. So select the year here, and you have to mention the OPD data here. And again, second year. So to both the years, you have to give the OPD data, the number of patients referred or seen in the center in last 2 years. Then provide the list of the outpatient department units with the number of average patient visits. Like you may be having a skin department, you may be having psychiatry department, you may be having a pediatric unit. So if it is a homeopathic polyclinic, so you have to mention how many patient visits happen during that year. So the list here, there is the add button, and there you have to upload the list. Okay, so name of the outpatient department and average patient visits per month, floor or the location where the unit is situated. Okay, in this way, the application forms look. Now, also after filling all this data, it is submitted, and after submitting, then there comes a acceptance or NC. Okay, so non-compliance. If suppose some data is missing or some data is not relevant, then the people over there, from the NABH team, they watch that, just see that, and then they can send a non-compliance also. And if it is proper, then they can accept it also. So it is called as the desktop assessment. So it is desktop assessment, which is completely online. When you send the documents, they just check it and then either accept it or either reject it. So that is seen as a red button. If it is NC, then you will find a red button here, that is NC is there. And if it is yellow, then it is being, it is accepted. And then also there is after acceptance, what happens, the third step is that they will plan a online visit, that offline visit. They come to your location and inspect the place. Okay, so this is the scope of certification, then the statutory compliance. Now, under the statutory compliance, there are various things like, does the center have a valid supporting document portraying the affiliations and accreditation? So that you have to mention whether yes or not, whether you have proper affiliation and license and all. Does the center have a certificate of incorporation disclosing the ownership? Yes or no, that you have to fill in. And does the center have a MOU with the biomedical waste collecting agency? That also you have to mention yes or no. And after that, if you submit the application, then third thing is that you will have to fill in all the relevant documents because you have mentioned yes, now you have to fill in the documents. Then does the center adhere to the standardized national international guidelines for the hand hygiene? Okay, so that also yes, and then you need to provide the training certification for that hand hygiene, whether they are following it or not. Does the center ensure standard practices as followed for the disinfection and sterilization of instruments and equipment as applicable? Okay, yes or no. For all these, yes or no is mentioned. Later on, you'll have to fill in the documents also. Does the center have adequate availability of disinfectant for cleaning and sterilization? So this is all about the infection control, questions related to infection control. Okay. Then does the staff ensure weekly rigorous cleaning and scrubbing of surfaces and floors and practices of staff with respect to biomedical waste handling and all the staff handling the biomedical waste provided with sufficient personal protective equipment? Then about the quality of care. Now, quality of care is directly related with the patient care. Okay, so does the center, after the initial assessment findings of the patient, have a documented plan of care, including the preventive aspects? Okay, so here all the questions are related yes or no. Later on, you will have to send them the SOPs. These SOPs, depending on your hospital, or clinic environment, you are going to prepare the SOP. Also, depending on the manual of the NABH, and those SOPs have to be sent to the NABH. They have to be uploaded. Does the center maintain the policy to guide the uniform level of care for all patients? So, with respect to the applicable laws and regulations, does the center ensure that the care of patient is in consonance with the defined scope? Does the center have a policy, SOP, to guide the provisions of services which are associated with the risk available in the center? Does the center have a policy or SOP to guide the care and treatment of vulnerable patients, high-risk patients, mentally ill patients, complying with the prevailing laws and the national guidelines? And does the center address special precautions to the vulnerable patients? So in this way, there are lots of questions which have to be answered, and then the relevant documents have to be submitted. There are questions related to quality improvement and patient safety, also medical administration. Okay. So if you go to the medical administration, then you have these questions like, does the center have a policy or SOP complying with the applicable laws and regulations to guide the center to meet the medication needs of the patient? Does the center follow the SOP to monitor the use of medication? Does the center ensure that they have a policy SOP to guide the procurement process, storage, labeling, and management of medication? So you can see the number of questions which monitor the quality of the care, of the patient care, or you can say the infection control at different levels. So there is no lacunae left, in relation to the patient care and safety. Okay. Then the questions related to HR, whether you have managerial people, whether you have full-time consultants, whether you have part-time consultants, visiting consultants, whether there are nurses or paricharikas, whether there are AYUSH therapists, males and females, technicians, paramedical staff, housekeeping staff, and security staff. And this is a mandatory process that there are definite number of people, these kind of people, okay, employees which are working. And all the required documents, their qualifications, their age, their experience, and everything have to be mentioned, and the documents to be submitted to the NABH while you're filling this application. Then about the training, then all these required trainings for the staff is very essential. So the record, maintaining the record of the training, okay, record of the NABH process as well. Because when the inspectors come for the NABH inspection, they also ask them about the different things like infection control, about the vision and mission of the center or the hospital. So the staff have to be aware of the responsibilities, okay, of the patient rights and responsibilities, about the working system, about the SOPs. Okay, so the training is also a very important, essential part of NABH. Then about the patient records. So does the patient's right charter address the rights for special preference, religious or cultural needs of the patients and their families? Does the center have an SOP to educate and counsel the patient about the costs incurred for the prescribed treatment? Does the center have a policy to inform the patient about the estimated cost when there is a change in the patient condition or incurred cost as per the treatment required? So these are all the questions related to the patient rights and responsibilities. Okay, so how it is patient centered, you can see how it helps the patients to have their things like. Then about the prescription, there are questions regarding the prescription, which also helps the patient rights. Does the center have a SOP to prescribe, dispense, and administer the medication? So the SOP is required for this, how the medicine is prescribed, how it is dispensed, and how it is administered. Does the center follow the guidelines of good clinical practice, evidence-based medicine in the medication and the prescriptions? So there, this is required, the date of prescription, name of the patient, and the registration, UHID number, name of the drugs, and the drug doses, and the route and frequency of administration of medicine, the name of the doctor, and the date and signature of the doctor, and the registration number. So all these are the mandatory things. Does the center prescribe the medication in the clear, legible manner, dated and timed? Does the center have standardized forms and formats to document patient details and treatments given, which are being given? Then about the consent forms. Okay, so these are the mandatory consent forms which are required. Like, does the center have a SOP to ensure that they obtain written informed consent prior to any procedure or any, treatment? Does the center have a list of procedures and treatments where informed consent is required? Does the SOP for taking consent includes information of risks, benefits, alternatives, along with the name of AYUSH doctor performing the procedure? Are the consent form in the language understandable by the patient? Are the consent forms available for the patient in bilingual language and signed before any intervention? So this kind of questionnaire is there, different consent forms are there. Further, there is the management of patient medical records. So different kinds of medical records are required. So there are the number of requirements, not only on the part of documentation, but also the different kinds of labeling and signatures on the signature boards in the clinic as well. Okay, so then there is a OPD registration process, the protocol which has to be maintained and documented. So the registration process, does the center have a documented policy for patient registration and admission? Does the center have a policy to register the patient only under the scope of service it provides to the community? So anything which is not out of scope of service cannot be given in the center, clinic center, or in the hospital. So whatever you are giving, the services you are giving, have to be mentioned in the SOP and have to be submitted to the NABH. And does the center maintain the register of the patients? does the center have standardized initial assessment, okay, and the scope and the content defined process based on the applicable laws and regulations? Does the center define the criteria mechanism to identify the patients who may need additional care? Does the center define the policy or SOP to proceed the additional specialized assessments for the patients who require the same? So in this way, that these are the different requirements which are already mentioned here in the website. So if you're filling for the application, you need to go through all this and be prepared with the documentation, and then you can submit all that. And all this have to be submitted within 30 days, the application, and then your process starts. Okay. Then there are the non-clinical and administrative departments of the organization: general administration, human resource, technical department, equipment management, laundry services, housekeeping services, management of clinical waste, management of non-clinical waste, which is according to the BMW Act and rules, patient advisory services, security services, fire services, and social services. So all these now what happens is sometimes the hospital or the center conducts all these things on its own. Sometimes these things are outsourced to the companies, like human resource may be there or housekeeping may be there. So if they are not able to manage, it is outsourced. And the outsourced MOU is given in the document, and the SOP is also given. If it is not applicable, then you can tick the not applicable part. Okay. Then there is the paramedical and allied services about the dispensary pharmacy, kitchen services or catering services, if it is there, physiotherapy, if it is there, okay. Laboratory services, sometimes the labs are also outsourced. If diagnostic and imaging services are there, they are also outsourced. Ambulance services may be outsourced or can be also kept. Then laundry and linen services are outsourced sometimes. So all these things, depending on your thing, then you can just mention it and you can submit the documents, relevant documents. So that's about the filling the application and maintaining the documents and submitting them. Now, if you go under this, you will find the guidebook, where you can just download the guidebook and read it how to format. Also there are portal manuals as well, which you can download, and you can read it for your knowledge. Okay, so that is about the filling of the NABH AYUSH entry level certification. After this entry level certification, a visit is made to your center or hospital, and all the documents are personally verified. Questions are asked to your staff and your head of the department or the doctors, and personally everything is verified, and then the entry level certification, digitally approved certified certification is given, and that you can put it in your center or hospital. Later, after the entry level, then comes the final level. Okay, then the process is more stricter, and whatever is left, okay, that is conducted in the final level certification. Okay, so that's about the NABH AYUSH entry level certification. Okay. So if you want to search the different hospitals which are, accredited homeopathic hospitals, that list is also here. You can go to this website and find out how many homeopathic hospitals are already accredited, and that gives you encouragement to make your hospital and center to also get accredited. So that's about it. You can ask me questions. Hope it was useful.
Yeah, exactly. Thank you, madam. Thank you for your awareness about the NABH. And the participants, please, if you have any questions regarding this, you can raise your hand and ask question to Dr. Rajeshwari Rapta. I think
So
that's
this is out of scope of the private practitioners. It requires means one person, what you say. Um, the clinic is always a one person establishment, only one doctor or a helper or cleaner or a compounder sometimes, right? So it becomes out of scope for many of the homeopathic practitioners. But if you take it to another level, thinking broadly about, either making it a polyclinic or taking it to a global, making it a global benchmark, then, automatically it will require much more efforts. It will require more manual work as well to make the documents, it will require more team members to make all the documents, submit all the relevant, certifications and all that. So it's a huge work. Okay. But there is a fruit to it. Uh, so I think that people should go through this website and study all that. And if it permits, if it comes under your scope to get your clinic registered, accredited for this, then that becomes much better for the healthcare system or Ayush system or homeopathic system in India.
Thank you, madam. Dr. Danesh, I think Dr. Danesh is about to ask something.
Yes, Dr. Rajeshwari Rapta, it's really a very good session. You really give us an in-depth details about this NAB accreditation, and in most of the government dispensaries and hospitals in Kerala is acquiring these things for the last so many years. So particularly for the last 3 years.
Yeah.
There was excellent improvement in our hospitals record, keeping record, registration, everything is much better. But only very few homeopathic doctors also have done this accreditation. They have tried for accreditation and they achieved the target in a good way also. But most of us are not doing the same because we people are in a comfort zone. That is the reason why we have enough patients and we are having these things, and why should we spend so much of time for all these things like that? Then we need to modify the clinic in that aspect, according as per the requirement specified by this team. So that may be the reason why most of the doctors are keeping away from this. But we know that in India, more than 3 lakh, recent estimates state that there are more than 2.5 lakh to 3.5 lakh homeopathic doctors here. But
Yeah.
that means that only even 1% of the doctors have not yet registered.
Yeah, that is true.
That is
So not only to get registered for NABH, but at least you can go to the website and you can check all the requirements and all for getting knowledge, especially the young talented doctors. They can explore the things which are, because they get a motivation that how really a clinic should be and what are the real requirements for improvement of the quality. And knowledge never gets waste. Okay. And if possible, they can also get trained under the QCI for this requirement. So if once they get trained, then they can become a part of the training professionals. There are very few Ayush NABH trained uh, practitioners, homeopathic practitioners, or doctors. So so the training requirement is also great. If you get trained, then automatically, when suppose government sometime in future, the government may make it mandatory for all the hospitals or clinics to get NABH accredited. So it will be a further step to get early prepared early for that, right?
that's that we will have to be we will have to upgrade our clinic as well as hospitals in such way so that those people sitting in other hospitals can
Mm.
understand that, oh, these homeopathic or Ayush doctors are also having this much of accreditation. People used to say that the homeopathic doctors are not equal to the so-called people from the other side. But once we keep all these things in that way, definitely they may also realize that we are also equivalent to those people. Am I right?
Yeah, let me tell you one thing. Dr. Hahnemann in the book of Organon, the first thing he mentioned is the mission of the physician, right? And in the NABH application format, the first question which is mentioned is write the vision and mission of your organization. So you can see how advanced homeopathy is in quality care or patient care. So Dr. Hahnemann, some 200 years back, he had that vision of the patient quality care. And now NABH is mentioning that in the application form. So you can see that homeopathy is nowhere backwards. It's like he had a great vision, Dr. Hahnemann. He had a vision of preventive care, he had a vision of quality patient care. So you can imagine how if homeopathic doctors take a further step, it will be a great thing for the homeopathy Ayush for making it better for the patient care and for the Indian nationals, as well as a very important step for medical tourism, because Indian homeopaths are much more popular at international levels as well, right?
Exactly. The most of the West is looking at the homeopathic doctors in India, particularly those who are practicing in private sector as well as in government sector. But there is no such setup called the government sector in Western countries, and we the only India is the only country in the world who has such a beautiful National Institute for Homeopathy as well as National Homeopathic Research Council and Homeopathic all these things, CCRH and all these things. So the Pakistan is also trying in that way, but they are nowhere with that with us. So so once we upgrade everything in such a good way, definitely the quality and quantity of homeopathy will be on the rise.
Correct. Yeah.
Is there is any specific requirement for the number of staff needed to apply for the NABH certification?
Yes, sir. Yes, it is there. You need to have housekeeping staff, you need to have training staff, you need to have a number of visiting consultants, or you can be yourself the head, and then number of clinical staff, one nurse. There should be at least one bed in the clinic. So all these things are
That's
required. There is a
that's also a
requirement.
problem.
There
Yeah.
is, if you are
Requirement is
interested,
not.
you just download the document of the requirements. There is in the website itself, it is there. Uh, and then you can just go through all that, and then you can think whether you can make your clinic, quality improved.
Doctor, is there any possibility of giving any financial assistance to our doctors who want to
Yes,
acquire all
but
those
I
things?
think, yeah, financial assistance is provided by banks. There are loans for the female doctors, especially there are schemes for female doctors who can, get at least minimum 10 lakhs to 1 crore, depending on their project. And yes, for male doctors also, there are loans, subsidized loans given by government. So you can just apply for loan because it requires staff, it requires the furniture, it requires all those things. And of course, all these things require money as well. So of course, it will give you the fruit of that once you get established in that way. automatically, people come to know about the renovated clinic and the staff and everything, and the marketing is obviously done. And if it can get, you get the opportunity to get empaneled in the government health schemes. So in that way, you're going to, flourish. So, as I worked for some of the, hospitals, I've seen the great improvement they have made. I have worked for the allopathic hospitals, but not for Ayush. But I had undergone the Ayush training as well. But I see that there are only few hospitals which have got NABH. So I thought that why not, most of now NCH has also made it mandatory for the college hospitals to get NABH accredited. So it is mandatory, but many of them are getting accredited and many of them are still on the process. So it's better if you get accredited. You will take the homeopathy to the national, the global, level.
Most of our doctors are running the clinic without even the help of the staff. So first they have
Yes,
to.
yeah, I know the thing. Uh,
Yeah.
what happens is at least a doctor to get established, it takes 10 years. So in that 10 years, there's a lot of struggle and everything. Yeah, if there are also people who have a lot of monetary backup, and they can also consider that. And those who don't have monetary backup and still they want to, go to that level, they can take
Even though some are practicing for 20 years, even though they are not even changing the clinic setup, no, running the same
I've seen that also.
homeopaths. Mostly
But
the
what happens is time will come, maybe 10 years or so. At least it will take 10 years. But it's always better you be updated with all these things. So suddenly, if there is a thing like demonetization or something like, where everything is just, in a fix, that there is a policy by the government that no, all its clinics have to undergo this change, then suddenly there will be, hurry and worry. So that should not happen. I think be updated and be prepared for the change, a better change.
Yes, we all know that from the early part of our career, we used to find it very difficult to get a scooter even because nobody was willing to give us scooter because we don't have the account in that way, or we need not to pay the tax. We were not tax payers in those days,
Yes,
and only those who are able paying tax can avail this kind of loan. So that was a pathetic condition in those days. But nowadays the banks are running behind doctors for loans. So you can take loan up to 10 lakh even without any guarantee. They are coming. But the thing is that if you are not able to pay back it as quickly as per their direction, you will face the risk of in your life. So no
yeah, that's
homeopath
true.
can.
That's true.
We know that a homeopath needs some time to settle down. All of a sudden, patient may not be able to. You may not be able to cure a patient as fast as a senior can do. But as we know that if we look at the history of Kent, he himself told that if you get at least 2 to 3 patients in the first week, that's a good sign. And if you get patients up to 5 to 10, even 3 to 5 in a month, that's a good in a week, in a day. If you get at least 3 to 5 patients, that's a good sign. So don't think that you are not getting 50 or 30 patients a day. So,
Exactly.
but the problem is that being a doctor from the younger generation, the amount paid by the newcomer or the patient will be comparatively less because they may think that he's an unexperienced doctor. So why don't why we should pay so much huge money? That is the controversial aspect that we face.
Nowadays, I think
So
people.
I would
Mm,
like to suggest that the machinery, that is our CCR, the National Council of Homeopathy, should give something for that. They will have to think,
yeah.
giving some subsidized scheme for particularly for budding homeopathic doctors, so that they can also establish
Yes.
themselves. Uh,
Yes. Yes. That's true. That's
Otherwise,
true.
government should give at least 3 year services to each and everyone in government sector on a contract basis and a rotating basis. But nowadays, the voice doctors are sitting; they are not rotating; they are permanent. They are working like permanent doctors. But the only thing is that every year their contract is renewed.
It should start from the college itself, sir. Whenever the students just are doing the internship, right from that time, they should be, get involved in the government hospitals. Starting from there itself, 3 years rotatory. They should get the at least on the contract basis or what, but they should get exposure to the government services. If it becomes mandatory, then there are some chances for improvement. And about the reforms, there are lots of reforms to be happening in the government level, like providing financial assistance to the young doctors to set up their clinics or for getting jobs and all that. That is also required.
Exactly, exactly.
So this is actually more concerned with the young doctors to think about going through all this documentation process and about the quality improvement process and all, and to study this as a part of the knowledge, like with whatever they're studying in homeopathy, just a part little bit diverted from that in the quality improvement process. So if they get the knowledge, and someday if it becomes a requirement, then they will not hesitate to uh, get their clinics accredited. So that
Exactly.
is for today. And still I think 5 minutes are still there.
Yes, Jose sir is there. Yes, sir.
Yeah. There is also one thing which I wanted to tell you, that in Kerala there is already Ayurveda is prospering a lot, and there are so many Ayurvedic spas and healthcare centers, and in a similar way, I think homeopathy also should start something similar to that, where homeopathic wellness spa or homeopathic wellness centers, which will attract the tourism, medical tourism. That homeopathy helps so much in skin disorders, also in psychiatric disorders, women's complaints, so geriatric complaints as well. So it works wonders, especially when this is focused or highlighted, or through social media or various newspapers, magazines. It will draw lots of patients. That thing can be adopted to spread the word about homeopathy, to make
Yes,
it more
sir.
glamorous as well as health focused, right?
Some of the lady doctors here in Kerala has already started the thing.
Hmm.
They are even running big gyms also, for ladies, and so that means the change is happening everywhere, and that will be a good sign for all of us.
Yeah.
Thank
So
so
thank you so much for listening to me
much.
and asking me questions. And I'm open for questions anytime. You can contact me, and that's all for today.
Anyway, thank you so much. You have given a great awareness about NABH. Most of us have not even have any idea about NABH before. Thank you so much for your awareness and about the details. Thank you so much. And I'm inviting Dr. Ram Parvesh Shah, sir, for giving out of thanks to Dr. Rajeshwari Rapta. And then we'll hand over the session to Malayalam.
Dr. Anjani and Namaskar everyone. Congratulations, Dr. Rajeshwari Rapta, Madam. very nice, excellent program, NABH awareness program, quality health, quality SCLC portal, and health quality, doctors, nurse training, and so very thanks, very good describe the NABH awareness program, IFPH, very thanks. Dr. Nasir, thank you.
Thank you so much. Thank you all the participants for joining with us. Thank you once again, Dr. Rajeshwari Rapta, and I'm inviting Dr. P. Shaila for moderating Malayalam session, or Dr. Danesha, who is
Shaila doctor will do. Shraddha has joined.
okay. Doctor, you're welcome. Bye bye, everyone.